In our last episode, we stood in silence with those left behind. We listened to caregivers, understaffed, overwhelmed, and often working without the right tools. We heard from patients whose lives were shattered by simple, avoidable mistakes. Today, we take the next step. We go beyond the grief, beyond the pain, into the world of possibility. What if the answer to a safer healthcare system was not hidden in more medicine, but in better systems? What if we could trace the journey of every drug, every dose, every diagnosis from shelf to shoulder with precision? In this episode, we explore how global health standards like those developed by GS1 are helping rewrite the story, not just for Kenya, but for the entire continent. In many healthcare facilities, paper records still rule. Prescriptions are scribbled. Labels are handwritten. Patient files are misplaced. In this chaos, one wrong move can cost a life. Across Africa, countries are reimagining healthcare. Some are using GS1 standards to digitize vaccine supply chains. Others are applying them in procurement, storage, and patient management systems.
Jeffrey Alo is my name. I'm the training executive at GS1 Kenya. Today we are going to understand the importance of the GS1 global standards in healthcare. And in healthcare, the benefits or essentially the importance of these standards in the healthcare, especially in countries with low supplies in terms of medical equipment, is that when you deploy these standards to these countries, one, it helps in improving patient care. Improved patient care essentially means that there is timely tracking of patient information with regards to the medicine the patient will take, the dosage to ensure the right doctors and the medicine is being administered at the right time. This can only be enabled or can be made possible through the deployment of GS1 standard. Number two, it enhances supply chain efficiency by ensuring accurate inventory management and also smooth transition of supplies, of medical supplies across the supply chain. So in places like Kenya, by bringing in the GS1 system of standards, it will enhance or it will ensure that the supply chain is properly managed across all sectors. That reason why GS1 standards help in improving patient care or improving healthcare system is by maintaining the compliance in the regulatory landscape. Now, for example, the Pharmacy and Poisons Board in Kenya are really trying very hard to align themselves with the international standards. So GS1 standards can come in hand to help in ensuring that the rules and regulations set by government is upheld to core. Now, in summary, I'll give an example of the pandemic when it happened. During COVID-19, there was the need for timely tracking of product information in terms of the vaccine to the administrative point. GS1 standards were worldwide recognized and recommended by the World Health Organization to ensure that the compliance and regulation set by government is enhanced. GS1 identifiers support end-to-end visibility in healthcare by answering key questions across the supply chain and care delivery. Using the 5W framework, what, when, where, why, the GS1 identifiers bring clarity and trust not only to products but also to people and processes across the healthcare supply chain. For example, when you go to the hospital, before a nurse gives you the medicine, he or she will scan the barcode on the medicine pack to ensure that she is administering the right medication. Also, she will scan the global service relation number on a caregiver ID and the patient's wristband to ensure that the people involved are accurately captured. Finally, the ward where you are operating will also be recorded using the global location number to ensure the accurate capturing of the place where all this action is taking place, thus ensuring that the right medication is given to the right person by the right people at the right place, and all this is done at the right time, thus ensuring traceability.
Traceability begins with visibility. But for systems to speak, they must speak the same language. From manufacturer to pharmacist, from warehouse to ward.
My name is Joseph Polo. I'm the team leader for software, data and membership here at GS1 Kenya. I would like us to think about traceability in the old-fashioned sense and then traceability in healthcare, right? So traceability in the old sense is just essentially track and trace of products within any supply chain. But in healthcare, it is essentially the same, but for healthcare or medical healthcare products and medical devices. So just to answer your question, medication safety cannot only come from dispensing of the medicine, but it comes from the point of origin. So in this case, in the healthcare supply chain, we have the manufacturer or the supplier, who is now the initial point of these drugs or medical devices. So from there, we move on to the distributors in the supply chain. So the distributors, I believe, exist in each and every country and have their own mode of operations. From there, we move on to the point of dispensing. So the point of dispensing can either be the hospitals or the pharmacists or the chemists. So when we think about scanning, in each and every of those points, when you scan, it brings different information. But when you're talking about traceability, it should not bring different information. It should bring the same information. Maybe just now, adding information from manufacturer to distributor and to the point of dispensing. Just to add on to that, in those three particular channels within the supply chain, there exists someone very important. Otherwise, even the drugs wouldn't be reaching our facilities, and that is the transporter or the logistic companies. So even them, we need to include them in the whole supply chain so that medication safety has a foolproof, closed loop, not a foolproof, but a closed loop within the supply chain. So what do you think when a product or medical device is scanned? Once it is scanned, it should be able to show the manufacturer. Once it is scanned, it should be able to show the distributor where it was housed, be it within Kenya or outside Kenya. And then finally, it should be able to show that it was dispensed at a particular healthcare facility or pharmacist X or chemist X with a certain prescription and by a certain doctor. So in this case, I am not a patient, but the patient in this case, who should be able to scan the particular drugs administered to them and have a whole traceability journey from start to finish.
Bidii didn't die because we lacked medicine. He died because the system lost track of the truth. A missing label, a wrong drug, a family torn apart. But his story and countless others are shaping the future. A future where care is not a guessing game, where every health worker is empowered, and where every patient is protected by design.
I believe the future of healthcare will not be as efficient without GS1 taking a huge role in it, right? So there has been a lot of buzz and noise around the globe from the healthcare bodies, WHO, USAID, Global Fund, you name it, that they would really want traceability to be a key feature in the healthcare sector, right? So here is where now we go back to the healthcare supply chain, right? From the manufacturer all the way till the point of care. And I believe we don't stop there. We go all the way to the patient themselves. So from the manufacturer, I believe the vision is for them to be able to produce drugs or medical devices that are fully traceable using the 5 key attributes. And how is this possible? It's possible using GS1 standards, and in particular the GS1 data matrix, since it is the one advocated for in the global space. We move on to the distributor. So the distributor will be able to benefit in a manner that they receive standards or products or medical devices that are already standardized using GS1 standards. Once they receive that, they can add on onto it any more information and pass it forward onto the point of dispensing or point of care, which are now the hospitals and the pharmacies and the chemists, right? So here they will have a bit, first and foremost, peace of mind. They're dispensing medication that can be tracked forward and backwards, right? And how will they be able to do this? They'll be having the batches, the expiries, creating systems that are GS1 approved or certified, that have all these standards from the manufacturer in the whole supply chain. In finalizing, I would like to say, maybe as a common one, what I would really like for myself, not only myself, but also future generations, is to receive affordable healthcare, proper medical or patient care. That is quite key. And just to be able not only to enter hospital and leave hospital, but enter sick, leave happy, and leave knowing that everything they have been, prescribed is something of good quality. Yeah. So just in ending, I would like to end with a story. Recently, I lost a friend, and he was of good health standing, but he was administered a drug, and he was told, right? He was told that the drug might have side effects. Unfortunately for him, he took it, and after taking it, after some few hours, he fell to the ground and passed. So if there was proper traceability, we could be able to say if the drug was okay or the drug was meant to be administered, because he didn't have any wrong symptoms. And this is just one of the many stories I can say in the future we can be able to avoid such with GS1 standards.
Because in healthcare, every label matters, every record matters, every life matters.